Hi, good afternoon. Why don't we get started? My name is Jim Greenblatt, and I'm pleased to be working this afternoon with Dr. Mariela Podolski. We're both child psychiatrists, been practicing for a long time. We've had careers in inpatient, residential, and outpatient and partial levels of care working with children. But we're here this afternoon to talk about uh, a new model of treating kids' mental health. It shouldn't be new, and it's going to be a discussion around functional medicine for pediatric cases, and it's going to be a discussion about our Psychiatry Redefined training for functional child psych. So I can move the clicker. Let's get started. So here we are. Um, Functional psychiatry. In the old days, when I first started 35 years ago now, I would, every presentation, every book, everything I did, I had to use the word integrative and functional medicine for anxiety or ADHD or anorexia. But over the years, it's just made more sense and clear to describe the work that we'll be talking about and the core essence of our fellowship as functional psychiatry. It just is integrative and functional. We haven't thrown away prescription pads. We haven't thrown away therapy, but we're looking deeper and helping clinicians learn about nutritional psych, understand the role of genetics. I certainly think we all can appreciate the role of lifestyle and hormones and the gut. And that's the umbrella of our training programs, functional psychiatry. So I've kind of tried to shift the discussion from not worrying about the numbers, about rates going up or going down. We get good news when, you know, overdoses went down a few months ago, front page headlines. But that is meaningless to me because I'm seeing patients with addiction every day struggling and families um, really not knowing where to turn. So any way we look at it, there is a crisis in mental health care, but I just try to help people see that there's also a crisis in the model of our mental health care. And what is that model? Whether you're a pediatrician or child psychiatrist, or nurse practitioner or naturopath, anybody treating patients, it's kind of embarrassing, but it is nothing more than an educated guessing game. And you and I both know doctors who are very good at this educated guessing game, and those are the ones we bring our kids to and we want to go to. But no one can really tell me the difference between Lexapro, Celexa, and Prozac, and the list goes on. We're making educated guesses. And, it's pretty much fast food mentality. And that is just the reality based on our pharmaceutical model and our insurance reimbursements. And, you know, there is another model. So if we look at any other area of medicine, okay, what's the model? Our medical model, someone has symptoms. This poor young child has a sore throat. You're not going to go to the doctor and just get a pill for a sore throat. Someone is going to measure and test the physiology, some objective findings to find out, is it strep? Is it COVID? Is it cancer? Is it, who knows what else could be? But we're going to look and we're probably going to do blood tests. And then we're going to do medication based on the physiology. Then we're going to check again and make sure it goes away. That's our medical model. Whether it's chest pain or headache or the sore throat. And again, whether you're a mental health clinician or pediatrician, you're treating mental illness, the only tool you have is listening. And maybe you've memorized the DSM and know the criteria for every diagnosis, but you're making a intervention. You're giving a 6-year-old child a medication I just heard a story of multiple antipsychotics in a 6-year-old, just based on a list of symptoms. Okay, no objective testing symptoms. You're sad, you get an antidepressant. You're anxious, you get an anti-anxiety. You get ADHD, you get a stimulant, and then depending on where you get the follow-up appointment, if you're in a community mental health clinic, sometimes I've heard it can be 3 to 6 months for the follow-up appointment. But symptomatic-based medicine is the only tool that we have as mental health clinicians. And it should be embarrassing, and there is a better model. Again, our patients, whether it's schizophrenia, bipolar illness, there's no objective testing to determine a treatment plan. And for many of us, when we were in school, we had to learn different causes of major mental illness. Let's just take depression, right? To pass your boards, if there was a question, what causes depression, you would have to say like anemia or the symptoms of depression, right? You would have to say anemia, low iron. You would have to say low thyroid, probably B12. You might say trauma. I mean, the list is pretty endless of what we were taught 40 years ago to answer the test. And then now we know there are many, many more possibilities, from inflammation to heavy metals to gut dysbiosis. But what happened from going to school and learning that low thyroid and iron deficiency anemia causes depression till we get out in clinical practice? How many psychiatrists or psych NPs are testing for anemia and thyroid and B12 and MTHFR and genetics? And that's the gap. That's the gap that Psychiatry Redefined is trying to fill in its educational platform. And I kind of want to start our little discussion by sharing at least my thoughts on the difference between integrative and functional medicine. So, integrative medicine has made its way into academia, into our hearts, our souls, our conferences. The APA last year's theme was lifestyle medicine. You have fellowships. You can take a 2-year fellowship to learn that sleep, hygiene, exercise, and diet is important for mental health. There are mindfulness training programs everywhere. You can get CME credits and insurance covers it. So integrative medicine has kind of made its way, but functional medicine, certainly for mental health, has lagged behind. And that's a core part of what we talk about. Functional medicine, root cause. Again, looking at nutritional deficiencies, genetic vulnerability, and that environmental kind of genetic dance. Root cause. It doesn't mean that the root cause is the only factor. It doesn't mean there's not trauma, there's not family history. It just means that we're looking at underlying biological factors that are contributing or resulting in poor outcomes or side effects to medications. So here we are, we've done it before. And the challenge, as clinicians is the work is not easy, because I love this picture, but it just reflects every patient is different. It's not one size fits all. We say in functional psychiatry, one size fits one. But by looking deeper, I'm convinced after 35 years, and we'll hear Dr. Podolski's story, that it can make a huge difference. So I don't know how many Malcolm Gladwell fans there are, but he had a discussion on this Minnesota starvation experiment. I don't know if you've heard about it, but these were conscientious objectors in World War II. Ansel Keys was a nutritionist. He was studying eels, but he was the major force of telling everyone not to eat cholesterol and fat. But that's another discussion. But this thing during World War II, we had these males, and you had to be healthy psychologically and physically to get in. They stayed at the university for, I think it was 3 to 4 months, and they restricted their diet, right? Cut 25% of the calories. They lost a lot of weight, but something else happened just by restricting calories. They developed psychiatric symptoms, depression, anxiety, OCD, obsessions, there's delusions. One guy chopped off his finger. Many continued to suffer, but a few months of a restrictive diet, not only do they lose weight, they develop psychological symptoms. So it's the simplest example to share with you, your patients, that malnutrition affects the brain. And, we see this one in anorexia nervosa, the most life-threatening illness in psychiatry. But here, healthy men were starved, they developed malnutrition, and guess what? Anxiety, depression, delusions, symptoms of anorexia nervosa in this group. Malnutrition affects brain function. The brain is the most metabolically active organ, utilizing 25%. So we're going to share with you just a few minutes. I'm going to just talk about vitamin D, and then we'll talk a little bit about celiac disorder, and then we're going to talk about the fellowship and hopefully engage in a discussion, because what we're doing in 45 minutes is synthesizing 400 hours of educational content in our program. So think about that for a minute, 400 plus hours of educational content on how nutrition affects mental illness. So we're all thinking or aware of vitamin D in terms of inflammation now and bone health and genetics, but I don't know how many people are appreciating the fact that vitamin D affects serotonin synthesis. It's actually the rate limiting step in the synthesis of serotonin. Okay, so vitamin D is required by tryptophan hydroxylase, that enzyme, to convert the amino acid, the essential amino acid you need to obtain from your diet, into 5-HTP to make serotonin. So deficiency of vitamin D has profound consequences for mental health. Decreased enzyme, low serotonin, depending on your genetics and lifestyle, you can add OCD, depression, or increased risk for suicide. The research is pretty staggering and overwhelming over probably 30, 40 years, more so in the last 10 years, that these deficiencies have profound implications. Okay, this is a 500,000, this meta-analysis of looking at vitamin D deficiency and suicidality. Vitamin D levels in patients with suicidal behaviors were significantly lower versus controls. Again, 20 or 30 years of previous research. This is last year, 2025. And we could go on and on. Vitamin D associated with anxiety, with depression, with Alzheimer's has been around for a while. And then the suicide research is coming out this year. And what you're going to hear on the headlines, if you just read the headlines, which is what many of us do, you're going to start seeing, or at least I have over the past year, a number of kind of vitamin D studies that were no effect. Because much of the research is just handing everyone the same amount of vitamin D. 100 people depressed, give them all 2,000 international units, see what happens. And what is clear from our work in functional medicine and from the better research, if you have low vitamin D supplements are going to make a dent. And I cannot tell you how many clinicians we have in our program that are telling us daily stories of low vitamin D in Southern California, in Arizona. And these are vitamin D levels under 10, right? We're recommended between 40 and 60. So not every depressed, anxious child will have a low vitamin D, but I assure you some will. We need to treat it. And as we know, only 34% of Americans have sufficient vitamin D levels. So when we start talking about an epidemic of mental health issues, think about the rate limiting step in the synthesis of serotonin. Think about every psychotropic that you are quickly drawn to, affects serotonin. So now I want to take a minute to just, since I think this is the best path of summarizing 400 hours of nutritional psych, to talk about a disorder that affects the malabsorption of almost every micronutrient, and that's celiac disease. So many of you might think of it as a GI disorder, but in our world, I think of this as one of the prime drivers of pediatric psychiatric distress, psychological distress, psychiatric disorders. And it's not just me, we have the literature that's been completely ignored by our mental health, and most of it's with kids. But here's a meta-analysis done a couple of years ago looking at celiac as a risk for depression, anxiety, panic disorder, and dysthymia. Okay, case-controlled studies. And here are some of the kid studies. Okay, childhood celiac, 19% increased risk of any psychiatric disorder, highest in the first year. And again, across many psychiatric disorders, eating disorders clearly missed. And here's another one with kids, high anxiety and depression. So what is this path? Because in celiac disorder, you have malabsorption of many micronutrients. We see often deficiencies of iron, zinc, B12, and tryptophan, right? Tryptophan being the precursor of serotonin. But you can get deficiencies in every other micronutrient. And to have such high levels of psychiatric disorder, it's just another kind of powerful example of what functional psychiatry can do for your patients. And again, in our workup, in our training program, we talk about how to test for amino acids, how to test for minerals, how to test for vitamins, how to test for essential fatty acids, because often we don't know what's deficient. But when we have many micronutrients, we have to look and test for celiac, and it's part of our workup. So now I just want to introduce Dr. Podolski. I'll let her introduce herself, but she'll kind of share some cases, and then the two of us will be available to answer any of your questions and to hopefully engage you in looking towards a functional medicine path for our kids.
Thank you so much, Dr. Greenblatt. It's a pleasure to be here. My name is Mariela, my last name Podolski. People call me Dr. P. And as Dr. Greenblatt said, I'm a child psychiatrist. I completed the fellowship a few years ago, and it has really changed the way that I practice medicine. And so I wanted to share with you 3 cases that I had in my office that reflect this profound nutritional deficiencies and the impact of those, of correcting those, and how that benefited my patients and really changed the way that I practice psychiatry. So this was a 12-year-old girl, and she came to me with emetophobia, which is fear of vomiting, and panic disorder. She wasn't able to eat in public, given that she was so worried that she was going to end up throwing up herself, and she was also really worried about other people throwing up. Um, she was having difficulty attending school. She was having panic attacks at school, really socially struggling, and her mood was very low at the time. She came to me. This was at the beginning of my fellowship when I had just started years ago. And so I started her on sertraline, which is really what I was, trained to do back in my regular psychiatry training, and increase the dose slowly to 150 milligrams over a period of time. And there was some benefit, but not enough. And she was refusing to get blood work done. She was really terrified of needles, and we couldn't get any blood work. But Dr. G, I think you have to pass them. I don't have. Thank you. Finally, we were able to convince her, and I ordered everything I thought I needed, and these were some of her deficiencies. She had very significantly low ferritin, which is the storage of iron. She had low vitamin B12 that we can see there, and low vitamin D. And next slide. And this was the other thing. She was my first patient that I diagnosed with celiac disease. This is her celiac panel, which is positive. And of course, I had a referral to GI for her, and they were able to confirm the diagnosis with a biopsy. But this was something I would have never thought of doing had I not completed the fellowship. And so this was one of the applications of functional psychiatry. We can move on to the next slide. And what happened was, short of being miraculous, really, we confirmed the diagnosis. She went on a gluten-free diet, and over a period of 6 months, she was able to go back to school regularly, eat in the cafeteria, had no concerns about vomiting and no panic attacks. And yes, we did have to continue working on the SSRI. However, her symptoms are so much better and better managed in terms of the OCD, emetophobia, and the anxiety and panic attacks are completely non-existent. And this is something we had not achieved only with the SSRI. She's currently on fluoxetine, and when she starts struggling a little bit, when she starts noticing that she's not doing well, and we are able to check her labs, there is evidence of contact with gluten, which is very telling. Right. Next slide. I'm going to talk about this other case. She is a 21-year-old woman in nursing school, again, OCD, and a history of anorexia nervosa in the past, who came to me with some OCD symptoms, not as bad as they had been in the past, but an increase in her panic attacks that she was having, sometimes 2 times per week. And this was a change from her baseline. She was already on sertraline when she came to me, and so I increased her dose to 100 milligrams and ordered labs. It took her a long time to complete them. And Dr. G, these were her labs. So multiple deficiencies, as you can see. She had very low ferritin. Again, that's low iron storage. It can affect a slew of different things, including concentration and energy and sleep. Her homocysteine level was elevated, and that molecule is elevated, as I learned, when there is a deficiency of vitamin B12 or folate, and that molecule increases, and that can be a contributing factor to her anxiety symptoms and to her panic attacks. She was also not profoundly, but she was significantly deficient in vitamin D. Next one. And she had a positive antibody here. So we sent her to GI, and she did need endoscopy, which explained her nutritional deficiencies as she was diagnosed with celiac disease. We started supplementation with iron, B12, and vitamin D. I did not change her dose of sertraline. And just with that intervention, when she had been gluten-free for 3 months, she started functioning so much better. Her OCD had lessened to 2 out of 10, had not had a panic attack in at least a month. Yes, her anxiety was present, but she was doing much better. And we started talking about decreasing sertraline. And so we did. And she, quote unquote, said, "I feel better than ever." Unfortunately, she moved out of state, so I don't know how she's doing, but this was another success story. And the reason for it very clearly was not necessarily the SSRI, but really understanding what was happening in terms of her nutritional status, her micronutrient deficiency, and the fact that she also had celiac disease that could in and of itself be contributing to the psychiatric symptoms. In my third case, this is a 14-year-old, so young girl, who I saw in 2021 for the first time, and she came to me with a very significant history of psychiatric treatment, including having been hospitalized after suicide attempt, after suicidal ideation and self-harm. She had already been prescribed medications, and the list is there: bupropion, clonidine, and hydroxyzine. And I kept her on those medications. She had achieved some stability, and not she wasn't really great, but she was better than she was before. We did regular treatment. We had found that she had an iron deficiency, a zinc deficiency, B12, vitamin D were added, also fish oil. All of these things were added, but I had not tested her for celiac disease. And finally, as I had started to get more confidence in ordering this test and understanding the importance, I tested her for celiac disease, and she was positive, which explained a lot of her deficiencies that I had been found before. And of course, again, once this is positive, we sent her to GI, and we found that after 4 months of having the diagnosis and being gluten-free without any change in her medications, her anxiety is so much better, her sleep is better. She's clearly, the nutritional deficiencies that she had were um, significantly associated to the celiac disease and the lack of absorption. And so now that she can absorb her food better and her nutritional status has been normalized, she's feeling incredibly well. And I am happy to share that after a couple of years of this, we were able to discharge her successfully from my practice. And the parents reached out to say how incredibly life-changing this intervention had been, something that I didn't expect as a psychiatrist to be doing, but it was pretty rewarding. And I really, treating these deficiencies has changed the course of all of my patients' treatment and the way that they're feeling over a period of time. All right, that's it, Dr. G.
Wonderful. Great. So we're just going to take a few minutes and put questions. We can't answer all the questions, but in the Q&A, and we'll try to get to them. But when you think of every mineral, essential fat, essential amino acid, every vitamin could be affecting the mental health of your patients. And what we've tried to do is develop a program. It's evolved. I think we're in year 9 or 10, into being able to provide um, a broad education in this kind of functional medicine. So we have two programs. We have the core general fellowship, we call it, and the pediatric fellowship. Um, Let me start with the pediatric first. This is where Dr. Podolski does medication supervision. Nancy O'Hara does a lot of the PANDAS work. I do a lot of the nutritional. We have genetic. We have multiple faculty working together both on meds, herbs, and nutrition to support this year-long training program. And then our general fellowship is more of an introduction. It's we talk about ADHD and pediatric disorders, but also focus on general psych. In both programs, infections are covered, psychedelics are covered, and genetics are covered. So I would like to just tell you a little bit about the fellowship. Don't take questions, and maybe I'll give a 2-minute overview. And Mariela, if you have anything you want to share, we'll go through these slides. So the program is set up where, even though I keep saying 400 hours, could be more, you don't have to listen to everything. There's a core curriculum. I don't know, it might be 40 hours. I'm going to have to count, but there's a smaller number that's part of the core curriculum where each month you're assigned a course. And that could be 3 or 4 hours. Could be depression, it could be ADHD, it could be anxiety. And then the discussion is with the faculty that gave the course, the expert. whether it's ketogenic diet, we have Georgia Ede, or Nancy O'Hara if it's pandas. But then twice a month, we have these live supervisions. And that's where the goal is you would have listened to the course, and then you'd meet with the faculty to review the topic. And you can ask a case, you can ask a question, and it's interactive. And I personally think this is what kind of defines our program as different than just taking courses, because one of many paths where you can interact directly with faculty. Anything, Marielle? I got a little carried away on that one. Do you want to
No,
add?
no, no worries. No, I think it is important for those who have other commitments and families to know that you can do this at your own pace and on your own time. And then you participate in the meetings that are interactive, as Dr. G said, which can really enrich your knowledge as you learn from others. And I find it to be incredibly helpful when I did it, that I could do it on my own without having to be really stressed about being quizzed or something along those lines. It really helped me.
And a good point, everything's recorded. So these are typically Wednesday nights, 8 p.m. Eastern time. If you're busy and life is taking you to put your child to bed or go out to dinner, then you can listen to it in the morning. Everything's recorded. So there's no required attendance. And I just will share my true confession. I was really hurt once a couple of years ago when someone said to me, the best part of the fellowship or in a review is this community forum, not my 300 hours of recording or teaching. Um, but the last 2 years, I would say I absolutely agree. This forum where we have hundreds of clinicians from around the globe and our faculty interacting, sharing articles and references and discussion. I learn something every week here. So it is a really unique part of our program.
Absolutely. I have to say with that that I have connected with other people that are doing the same thing as I am doing in my practice, and we often can share information or answer questions to each other. And it feels really good to know that you have a sounding board on where to to ask questions and get answers in real time and real life as you learn how to do this. The fellowship itself can be so transformative when it comes to your practice. These are things I had never learned, and yet once I learned and started doing them and saw the real change in my patients and how much better they are functioning and doing with, yes, medication, but maybe less so, and some of them without medication altogether, it is very, very rewarding. And to see that community makes it like other people doing the same and sharing the same results is very uplifting and makes you kind of want to be a better physician or a better nurse practitioner or whatever it is that you're dedicating your time with your patients, like whatever your profession is.
So just two quick things that I remember from today. Now, you can get these emails all day long, or you can get them at the end of the day or only go online. But someone shared a side effect to a zinc supplement, hives a child got, and people responded. Someone else shared an article that kind of flipped everybody out, where someone wrote about omega-3 and some of the research saying that it actually speeds up cognitive decline, and everyone panicked. And then we had all these people sending in references supporting omega-3. So lots of fun stuff going on. The mentoring sessions, the in addition to the supervision on the courses, we have mentoring sessions on some of the challenging testing, like organic acids. So I think that is once a month. Genetic testing, Genomind and Intellex DNA. We have monthly mentoring sessions on zinc and copper and some of the challenging topics that people continue to have questions. We have additional mentoring sessions for that. Anything to add? And here's my, well, now we have over 400, and there are CMEs, um, at least 75 in the core curriculum. So you don't have to listen to all the other ones. And I don't know if you got to use this yet, Mariela, but this is a new tool. I used it a number of months ago, and then they added stuff, and now it's live, and it's really incredible. I don't know about anybody else, but I've signed up for a lot of AI tools, paid $50 here, $100 here, and they're just spitting back the same information that I get if I Google or go to AI. But our clinical navigator is the only platform I know of that put in it has just has functional medicine. So you can get doses of supplements. It has all of our core curriculum, and we're continuing to add it. So this is just a free part of the program that you can use. Have you got to use it yet at all?
I have not, no.
Okay.
But now
Well,
I'm curious. I'm
yeah,
gonna
we
look
just
into it.
launched it, so try it. And then there's quarterly meetings that we might even increase on how to start your practice and grow it from marketing to how do you order these functional medicine tests. We actually have all our tests put on one panel to make it easy to order, how to order supplements. I think I'll pass on this one.
I'm happy. I hablo español, and I'm from Costa Rica, so my first language is Spanish, and I'm more than happy to be in charge of all of my Spanish speaking peeps. For those of you who English is your second language and Spanish happens to be the first, you can absolutely join this group, and we can be more comfortable in our own language. I think sometimes it's hard if English is your second language to speak publicly and get your ideas across. So I feel your pain, but you're safe with me.
Great. No, it's really, we have a number of Latin American countries. And then, we have this incredible now that has just been released and updated a provider directory where if you want, it's completely optional. If you're looking for patients, um, you can be listed in the directory and patients can find you. A number of fellows who started with us years ago, practices are full because of this listing and can't, accept any new patients. And you'll get patients from around the globe if wanted. But it's just a nice kind of augment to the program if you're looking for patients. We have a large volume of people looking through our sites.
And I
And
do,
then,
and for that,
go ahead.
Dr. G, I do want to say like it does sound like, oh, my name is only on the list, but I think Psychiatry Redefined is a big place where people look for answers. And in my private practice, I get a lot of phone calls that are coming from this referral listing. And it's very helpful when they say like, oh, I know that you do this, and so the patient comes already with that mindset and makes it easier for everyone involved. Is a fantastic source for referrals for me.
Yeah, I mean, certainly one of the challenges of clinicians is how do I order a test that might cost $100? I'm not used to that, and they feel uncomfortable. But as Dr. Podolski shared, our patients are looking for someone who understands how to use supplements, understands the testing, and through our network, they'll be able to kind of know what they're getting into. And just some ease of integrating with your calendar and we have a number of programs. We have incredible webinar series. Um, we also have what we call intensives. And as fellows, you have I think we have, here's our intensives. So you have access to these programs. That's why we call it the Fellowship Plus. So ADHD is starting this month. Hormones is just finishing. You can get access to that. We have eating disorders, nutritional psych, we have antidepressant withdrawal, depression, all these kind of 3 to 4 week sessions where there's just a little more intense deep dive, and there's also a lot more uh, kind of supervision if you ask. So that's all included. And then, here's a part of our faculty. There's more. Um, but as you can see, we try to pick the experts in the field. So Dr. E talking about ketogenics, Dr. Gersh, OB talking about hormones, Dr. Patterson talking about herbal therapies, Dr. Cohen, genetics, Nancy O'Hara, and our Dr. Podolski. But these are just some of our faculty that contribute their expertise. Dr. DeWitt talks about antidepressant withdrawal. So I think it's an incredible group, um, and you'll learn. And you do get a certificate. Well, I guess my name is here, signed. And I don't know. I'll end on this. And Mariela, any thoughts? I'm going to take questions, but um, I'm quite confident patient outcome improves. That I can tell you from 35 years. But I'm also talked to enough doctors that who've struggled with, career satisfaction, just improving, gone from the quick 10-minute med check to being able to spend time and use words like cure and remission.
I typically say to my patients, I know that this is uncommon, but if we get to a point where you fire me because you're able to move on, I know I have done my job. And that's really a good way to put it, is by doing functional psychiatry, I have been able to really treat patients to the point that they no longer require psychiatric care with medications, and they have been discharged from my clinic successfully. And that's a wonderful feeling that I didn't have before when I worked in other settings without having had this knowledge.
Great. So we're hoping you take advantage of kind of well, these are my latest book on lithium and functional medicine for depression. But if you want to join us and learn more, schedule a call with one of our educational consultants who can kind of help see if the program is right for you. Um, and we're happy to talk to anybody who has specific questions as well. So, so I'm going to ask, see if there are any questions. How do you test for celiac, Dr. P?
Yeah, that is made easy to you by Quest, and you just have to order a celiac diagnostic panel, and it gives you all the antibodies and titers that you're looking for. It's pretty simple. However, that is a blood test, and most of these patients do require to be referred to GI for confirmation of the diagnosis, make sure it's not a false negative, and typically that diagnosis is made by an endoscopy and a biopsy. But that's the test. It's just a blood test, and anybody can order it.
Great. Someone asked about my favorite micronutrient. We're actually going to have a webinar on it, OPCs. Any contraindications? Unless someone's allergic to one of the products, which is usually curcumin, green tea, grapeseed, then there's none that I have seen. So we'll be talking about that, and we talk a lot about that with ADHD. Okay, Dr. P. Is a GI doctor referral difficult? Why not just go on a gluten-free diet based on the blood test?
Well, I do think it's good practice to have the GI opinion. I mean, and sometimes if the blood test is enough from their expertise to make that diagnosis, then they'll leave it at that. And that has happened in the past with a couple of patients. But sometimes there can be other GI things that I'm not aware of and I'm not really qualified to understand. And so I leave that to the experts. But I definitely think that making a diagnosis of celiac disease is not that difficult. But the confirmation of it, I would say, requires, and they require also follow through. They can get through the GI clinic. They often get access to a dietitian and regular meetings, and that is important, I think, for the rest of their life. This is a chronic condition that I am not going to be managing, and so they need somebody to be in charge of that.
Okay, we're checking zinc and B6 level be comparable if someone can't afford a cryptopyrrole test. Um, I'll answer that. So one of the tests that we talk about that I think should be required for every psychiatric patient is a test called cryptopyrrole. I think it's $100. Um, and I think it's incredibly valuable. But zinc and B6 levels do not always reflect elevations of cryptopyrrole, so I have not found it to be helpful. Um, and we'll be talking more about that. But that's a core test that has profound implications because, like celiac disease, there's a treatment, and a treatment can result in remission. I can use words like cure. And for cryptopyrrole, it's a test that if it's elevated and we treat it with very inexpensive micronutrients, B6 and zinc, patients' symptoms can dramatically get better. And I think hopefully, not everyone, but we try to encourage patients to do that test. The program is open to unlicensed but certified practitioners. So the program is built for physicians and nurse practitioners and naturopaths who can order the testing and recommend supplements. The pediatric fellowship, um, again, Dr. Podolski, because there are a lot of pediatricians, works with medication supervision. We've had therapists and coaches, a small minority who've taken the program, who have a lot of experience, but just, with that warning, we're not going to restrict anyone from taking it, but it's geared towards, someone with that science background who can prescribe. Supplements for ADHD. Well, I would encourage you to read my book, Finally Focused, and we have actually an upcoming intensive. I think it's 4 sessions on ADHD. So please look for that. So Dr. P, someone's worried that every patient you've ever seen has celiac disease.
No, not at all. Quite the
Do you get other
contrary.
deficiencies, I guess is the question.
Other deficiencies than that are not celiac,
Yeah, the root
or
cause of anxiety. Um,
yeah, I mean, there are many other deficiencies, and you can get, as you go through the fellowship, you'll learn many other things that you can test for and imbalances you can look out for, gut dysbiosis and other things. So it is very hard to just bring it down to these. Everybody has low zinc or everybody has low vitamin D, and that is the beauty of the fellowship is like there is one size fits one, right? Like the zebra analysis, everybody's different. The reason why we bring up the celiac disease is because they often have profound micronutrient deficiencies that affect many different areas, like zinc and B12 and iron, and the homocysteine level might be elevated, and copper might be high because the zinc is low, and other things that we are looking into. And with that said, when those patients get nourished because their micronutrients are finally being absorbed with a gluten-free diet, the profound difference in their psychiatric symptoms is undeniable. And so those are great examples to understand the role of um, micronutrients in psychiatry. But no, we have a lot of different odd things that happen in my practice that are different deficiencies and things that we can fix, which is beautiful. I hope that answered the
right.
question.
Yeah. Insurance covers many of the core labs that we recommend, what we just discussed, celiac panel, B12, D, iron, but certainly not cryptopyrrole and some of the functional labs. The AI tool, it'll be offered in the membership, kind of a very low fee post fellowship. So people, stay on for years, being part of the community, and the AI will be in that model. The focus for the pediatric group, again, it's a little less than 50% pediatricians. So the age, is it covers all ages, but I would just say from 4 up. Um, if you only work with, 17 and over, maybe the general fellowship is better. Because I'd say 40% of the pediatric is Nancy O'Hara talking about ticks and pandas and frat antibodies. Um, so if your focus is 17 and over, I would go to with the general fellowship. Therapist. There are many places where therapists can order labs if you think it's in the scope of practice. Like there are like Rupa and DHA labs do have a platform where under there's doctors that they use. So there is a path for you to use these labs. Okay. I think we hit most of them. Dr. P, any final parting words for our group
Mm.
today?
Yeah, I can only say that if you're thinking about having this integrated into your practice and having this functional approach and you already have the bug a little bit, I would highly encourage you to take the fellowship. It is life-changing as a clinician, but more importantly, to see your patients doing so well with these interventions that after a while just become second nature and are really simple when you think about it, but you need to have the evidence and the science to understand it, and that's exactly what the fellowship offers. So you won't regret it. Um, just do it, like Nike. Just go for
Yeah.
it.
Thank you, Dr. P, and thanks for joining us this afternoon. I appreciate everyone taking the time and energy to at least think about how we can improve outcomes for kids. Kids are struggling, parents are struggling, and we're just offering an adjunct to every other kind of modality that you know as a good clinician, be it medications or therapy or EMDR or ketamine or TMS. We're just kind of increasing, um, adding tools to the toolbox. So thanks again. If you're interested in hearing more, look at the website, schedule a call, and I think you'll appreciate the incredible breadth of the faculty and particularly the individual or group if live supervisions. So thanks again and have a good day. Take care.
Thank you, Dr. G. Bye bye.